Hello everybody, I am Dr. Shrish Mishra and I am an orthopedic surgeon. I specialize in cell transplant, joint replacement and sports medicine. So we are going to talk about avascular necrosis of the hip. This is one condition in medical science which has been an enigma from over the years. So let me explain you what this condition is all about. This is one condition in which the blood supply of that particular part of the bone just gets cut off and the bone becomes dead. Mostly it involves the hip region, and femoral head is a very common area. Uh, I will explain you through the X-ray here that what actually happens when this condition takes place. Now this is an X-ray of our hip. This is a pelvis and this is the both hips. This is a condition of a very young fellow who is a teenager suffering from bilateral avascular necrosis of the hip. As you can very clearly see here, the head is not round. Usually this ball is very round. So in avascular necrosis, this area has become dead. And since it has become dead, it is unable to take the weight and it gets deformed. And you can see these small focus areas of lighter lesions. These are the areas of dead bones. In this condition, both the sides are involved. Patient usually complains of early pain. Unfortunately, very little is known about the cause of this condition. Although few conditions like steroid intake, hormonal disbalances, and alcohol intake has been associated with this condition. But to be true, a lot has to be known about this condition. Much is not known about how it happens. And all the more, it usually affects a very young people. So, what do we do in this? The first thing is to diagnose this condition as early as possible. Since I have devoted much of my time studying this condition and pioneer one of the treatment, I have come to know through a lot of patients that they are diagnosed very late. So I always suggest to the physicians, if anybody comes with a hip pain, do not omit that hip pain for a long time. If he persistently comes with a hip pain and you find his movements are restricted or they are painful, please do investigate him radiologically. And still, if you don't, there are a lot of times you don't find anything in the X-ray in early conditions. In that case, MRI is necessary to be done to diagnose this condition. This is because the chances of recovery in this condition is brilliant if it is diagnosed early, and it diminishes as the stages go across from 1 to 4 stages. Now let us talk about one latest treatment about AVN. I am one of the pioneer surgeons in using cell transplant, which are autologous osteocyte implantation in avascular necrosis of the hip. I have a large follow-up of 2 years where I operated this young gentleman of 25 years. Till now, I have been blessed with very good results, with the patient improving drastically in their range of movements, in their pain control, and radiologically there has been a good amount of healing in my cases. Now what is this cell transplant, you must be wondering. Well, this is a highly bone conservating procedure. In this, as a first procedure, we harvest the bone marrow, which is a 15 minutes procedure. It is done under local anesthesia and the patient is discharged after 2 hours. No admission is required here. Then these cells are sent for culturing. Here, this is a very high biotechnology in which the osteocyte, which are the bone forming cells, are removed from the bone marrow and they are multiplied outside the body to a tune of 4.3 million. These are the powerhouses and these are the cells which bring about the healing of the dead areas. Primarily in the pathology of AVN, why the AVN avascular necrosis area do not heal is because of lack of these healing cells. Now once these cells are harvested and they have been brought to a certain number, which takes about 4 weeks, I plan for my second surgery, which is called implantation of these cells. This is a very highly conservative surgery. As I told you, I only give about 1 centimeter to 2 centimeter of incision. I create a tunnel from here, a bone nut tunnel to the area of necrosis. Necrosis means the area which is dead, and these are the specialized instruments which are even designed by me. So through these instruments, I clear up all the dead bones from the area of this necrosis. And then I fill up with the live bone, and behind it I inject the live cells, which are called autologous cell transplant. Now it fulfills all the criteria of healing. First, you have removed the dead bones from here. You have given it a structural shape by putting a live bone here, impacting the bone here, so also giving it a structural integrity apart from creating a shape. And these cells do the rest of the work because there are 4.3 million healing cells injected behind this bone. Eventually this bone heals, and that is what is required in AVN. In this procedure, when the healing takes place, no lifestyle modification is required, like what we do in joint replacement surgeries. The advantage of this surgery over the joint replacement is that this is a very bone conserving procedure. It does not require any lifestyle modifications. And as every joint has, as you know, in all the joint replacement, we remove this bone. It is a journey of no return. If for any reason this hip does not work, then you are, or anybody is heading for second hip replacements. In this procedure, the biggest advantage is this is a highly bone conserving procedure. We do not remove anything, we only supplement the bone. If the healing happens as it is required, nothing more is required, no lifestyle modification is required, your hip is back to the shape. In case if this procedure fails, still one can go for joint replacement surgeries. So I would advise this in all the young people in which the joint replacement can be avoided because of their age, or they are in very early stages of the disease. This procedure should take a precedence over any joint replacement. I hope I am able to pass on the message about this treatment, which I am one of the pioneer surgeons. And if you have any queries, you can write it to me on docshrish, docshrish @gmail.com. I will be very glad to answer all your queries. Thank you very much.